The gallbladder is a pear-shaped pouch underneath your liver. With the liver, it attaches to the small intestine through a series of tubes called ducts. Bile, a substance made by the liver to break down fat, is stored in the gallbladder. When fatty food from a meal reaches the small intestine, the gallbladder releases bile into it to help digest the fat. Cholecystectomy is a surgical procedure to remove the gallbladder. It is usually done when there is evidence of gallbladder disease, such as gallstones or polyps. It is also done for biliary dyskinesia, which is a condition where the gallbladder doesn't work properly. Laparoscopic cholecystectomy requires only small keyhole incisions through the abdomen, known as ports. To reach the gallbladder, the surgeon will insert tubes, called trocars, through these ports. One port is usually located at the navel or umbilicus. Carbon dioxide gas pumped through the umbilical port will inflate the abdomen so its contents can be viewed more easily. Next, your surgeon will insert the laparoscope through the umbilical port. Images from its camera will be transmitted to a video monitor in the operating room. Using instruments passed through other ports, your surgeon will grasp the gallbladder, clip off its main artery and duct, drop it into a specimen bag, and remove it through one of the ports. After the laparoscope is removed, a port valve will be left in place briefly to allow all of the carbon dioxide to escape from the abdomen. The incisions will be closed with sutures, followed by skin glue or skin closure tape. If there are complications with your laparoscopic procedure, your surgeon will switch to an open procedure with a larger incision.
Your surgeon will pull a section of the vas deferens out through the skin cut. The vas deferens is cut and the two ends are closed with stitches. The two sections of the vas deferens are put back into the scrotum. The skin cut is closed with 1 or 2 dissolvable stitches or adhesive strips. This is the end of the animation.
A tubal ligation procedure is a permanent method of birth control, where the surgeon cuts or seals off the fallopian tubes in order to prevent pregnancy. Next, your doctor will introduce a lighted instrument called a laparoscope through one of the incisions. The laparoscope projects images of the structures inside your abdomen onto a monitor. Through the other incision, your doctor will pass surgical instruments to grasp your fallopian tubes and close them off using the cutting and tying, blocking, or sealing technique.
To prevent pregnancy, a doctor places an IUD inside a woman's uterus with the string hanging down inside her vagina. Both
Yes.
Stainless steel anvil, cutting knife, stapler cartridge, safety cover, silicone ring, titanium staples, cartridge cover, cartridge cover and cannula, moving handles, adjusting knob, safety lock. Please read all information carefully. Failure to properly follow the instruction may lead to serious surgical consequence. Indications: intended use. Disposable circumcision stapler is intended for the controlled removal of the foreskin of the penis during circumcision. After routine disinfection using local anesthesia or any other effective means of anesthesia, lift the prepuce with hair mastics. Screw off the adjusting nut counterclockwise. Take out the anvil and insert it inside prepuce in a way that it completely covers the glands. If required, you can lubricate the anvil for smoother insertion. Make sure that the anvil covers the glands fully and at the right angle. The inclination of the anvil should be parallel to the coronary sulcus. Use the suture line to fix the prepuce on the rod of the anvil. Any extra foreskin must be manually removed. If it is not removed, it may result in an unsatisfactory cutting experience. Gently pull apart the cartridge safety cover and slowly insert the rod of the anvil into the cartridge body. Screw back on the adjusting knob. Keep on tightening the screw until the surface of the metal insert is slightly protruding outside the hole of the adjusting nut or is on the same level. The adjusting nut is in place now. After this step, remove the safety clip. Hold the handles, fire and keep your hands stable for 10 to 15 seconds. Loosen the adjusting nut and remove the stapler. Wrap it up with dry gauze and bind it properly with an elastic bandage.